All right, so today I'm talking to Kelsey Hroch, who is about to finish the program at the Canadian College of Naturopathic Medicine, and she will soon be a licensed naturopathic doctor. So Kelsey, can you tell us about what kind of education do naturopathic doctors get?
Yeah, so our education is a lot more intense than people might think. So we have to start with a 3 or 4 year undergraduate degree, first of all. It can be in any discipline. It doesn't have to be science-based, but you do have to have the science prerequisites. So the chemistry, the biology, and all of that good stuff.
Yeah.
And then after that, you do your application process, and then it's 4 years, either in Canada, there's 2 schools, one in Toronto, one in BC.
Yeah.
And it's the Canadian College of Naturopathic Medicine. And then there's also schools in the US as well.
Absolutely. So in terms of your undergraduate degree, what was your undergraduate degree in?
I did biomedical biology at Laurentian University in Sudbury.
So you were super prepared for all the
was.
biology and
Yes.
chemistry. My undergrad was in psychology.
Okay.
So I had to go back and get all of those science prerequisites.
prereqs,
So
yes.
that part was more challenging.
Yeah.
Now, how do you find the comparison from the workload of your undergraduate degree, which sounds pretty academic and intense to begin with,
is, yeah.
versus the curriculum in your 4 years of naturopathic college?
I would say there's really no comparison how intense it was going from my undergraduate degree to CCNM.
Yeah.
They really, drill it home with the education. So the first and second years are really intense with the biomedical sciences. And the exam process is nothing like I've ever experienced, right? So in undergrad, you might have 4 or 5 exams. They're spread out throughout the month. You're not really taking classes throughout that time, so you have a lot of time to prepare. At CCNM, we have 10, 12 exams in 2 weeks. So a lot of times you're having 2 or more in a day. So that was really intense and vigorous for myself and a lot of my classmates as well.
Absolutely. And none of you are any slouches to begin with,
Right.
right? Yeah, I remember having to change my study strategy because
100%.
in undergrad, I had intense attention to detail. I reviewed every single note I took in class. I wrote everything out. And then being plunged into this super intense curriculum, I was having to say, okay, where can I cut corners? Because I literally don't have enough time in the day to eat, sleep, and study everything the way I used to study.
That's right.
So
there's just not enough time, and you can't know everything, right? So that's something a lot of us perfectionists have trouble with. We want to know everything. We want to know it well, and it's impossible.
So Kelsey, I understand that in your clinical year at the Canadian College of Naturopathic Medicine, that you are on one of the fertility-focused shifts.
I am, yes. So the fertility-focused shift at CCNM, it's an application process to get onto that shift. It's something I'm very passionate about, and I've been fortunate enough to practice under the license of Dr. Christina Meffe at CCNM under the fertility-focused shift. So it's been really great.
That's awesome.
Yeah.
So let's talk a bit about the foundations of fertility. So say, for example, you have a patient, she's in her early 30s, she's been on the birth control pill for 15 years, she's just about to go off the pill, and she's ready to get pregnant in the next year or so. What are you going to look at with a patient in that situation?
Yeah, so in that situation, there's lots to talk about, right? So even being on the birth control pill coming off, there's maybe some nutritional deficiencies that we can correct from being on the birth control pill for so many years. There might be some hormonal balances that have to be addressed at that time. In terms of the foundations, getting back to our pillars of health that we always talk about, sleeping, eating, stress reduction. Yeah, our nutrition is really important. Making sure the gut health is right, stress and all of that. So there's lots we can talk about.
Absolutely. Yeah. And oftentimes it's specific to that patient too. There's not a one size fits all plan for fertility. So interesting you mentioned digestive health as well. As I'm realizing that sometimes the birth control pill can lead to a state of dysbiosis, so an imbalance in the good, the bad, and the neutral bacteria in the gut. And I've seen a lot of SIBO, small intestine bacterial overgrowth, that seems to be related to being on the pill for many years.
And does that seem to come to light after coming off?
Yeah. Well, yes and no. Sometimes she's still on the pill. Sometimes she's off of it. And But yeah, if digestion is not working properly, that's a great thing to sort out before the positive pregnancy test.
Absolutely.
Because once a woman's pregnant, there's a lot of herbs we can't use.
That's right.
We're all about safety. It's not just about using what works. Safety is paramount. And so, a lot of the herbs that I would use to get rid of nasty bacteria that are hanging out in the small intestine, I can't use those when the woman's pregnant.
Right. Yeah, so it's something definitely to address in the early stages, for sure, when you're even thinking about conceiving. So,
and that's preconception healthcare. And I like to differentiate that from fertility work, because sometimes people think, well, I'm just going to go off the pill or ditch my contraception and start trying. But it's really nice to be proactive about it. And I love it when patients come to me and they say, my health is not optimal and I want to get pregnant in a year or two. And I'm like, thank you for showing up now. That's great.
That is a great first step. And a lot of people don't know that we provide that care. So, some people might come off the pill. They might be able to get pregnant right away. Everything's good. Yeah. No issues. But some people might come off, they try for a year, and then they search, then they look for help. So if we can start earlier, that's the best for everyone involved.
Absolutely. Yeah. So let's talk about irregular periods. I'm sure you've seen that on the fertility shift.
Something that women and individuals struggle with in general is irregular cycles, and there might not be, a known reason. It might be, there might be something going on that's hidden that we don't identify right away. So there's lots of things we can do in terms of like hormone regulation and balancing, and really doing that investigation piece to help them figure out why it's happening, getting to the root cause.
Yeah. So all the proper lab tests. So we want to test like testosterone, progesterone, estrogen. We want to look at hemoglobin A1C for blood sugar balance. We might want to explore insulin resistance to see if PCOS or polycystic ovarian syndrome is at play. Like there's a lot that we would need to do to, like you said, get to the root cause, and then use our herbs, vitamins, supplements, and diet and lifestyle interventions to get that person back to a state of balance.
Right.
Now, I noticed that you said woman or individual, and I think that's really important because we need to remember it's not just women trying to get pregnant. We have transgender individuals who are trying to achieve pregnancy.
Absolutely.
And looking at chest feeding, which is a term that we would use for someone who's trans, who doesn't jive with the term breastfeeding, right? So that's important for people to know as well, that as naturopathic doctors, we're supportive of the health of queer and trans people.
Absolutely.
And I had the opportunity to do a course with a midwife friend of mine in 2020 where we're both queer identified, and we did a course for queer people who were planning their families, right? Awesome. Whether they were going to like adopt or have babies, and like, okay, who here has a uterus? Does anyone have sperm? Do we need a sperm bank?
Right.
How are we going to negotiate this journey? And so it's been exciting for me in my practice to see other members of the queer community come in and say, this is how we are creating our family. And I can advocate for them in that capacity. And you don't have to be a queer ND to do that, right?
Right. It's just about making naturopathic medicine accessible to everybody. So
yeah, totally. And I think for anyone who isn't in a traditional heterosexual relationship, the pathway to pregnancy and parenting is different. And so naturopathic medicine has a lot to offer.
Absolutely.
There
a lot we can put our 2 cents in about, for sure, and just provide that education piece again.
Yeah, absolutely. So on the fertility shift, I know like you've been there since May, is that correct?
May, yeah.
Okay.
Almost. Yeah.
So have you seen some like successful pregnancies on that shift
Yes,
yet?
we have. Not just only, patients that I've seen.
Yeah.
But all of my other coworkers and colleagues and other interns on that shift, we've had some great successes and some sad times too, right? With fertility, there comes some some trauma and some, there's always history of miscarriage for some women, and some individuals try to conceive. So there's ups and downs in fertility.
Lots of ups and downs. Yeah. Absolutely. I mean, the rate of miscarriage in general is about 1 in 5 pregnancies end in miscarriage. Some of them early on.
Statistics are just...
Yeah, most of them are in the first trimester, but it doesn't make it any less traumatic for the person experiencing that, especially if they're really ready to have a baby, create a family in that way.
They've been trying for a long time.
Yes. Yeah, absolutely. It can be quite devastating. So I've had the honor of being present for patients who've gone through that. And I feel like I've learned a lot as a practitioner and just as a human being on this planet, right?
Yeah.
Just about, the process of grief and how resilient people can be.
Yes.
Yeah.
Lots of resiliency for women undergoing, IVF treatments, IUIs that might not be successful. So there's a lot of resiliency in this population for sure.
Yeah. And that's something we can talk about is, managing disappointment, managing grief, and getting those coping mechanisms re-engaged, whether it's regular exercise, reaching out to friends and family. Because people they'll get upset when their plan doesn't go according to plan. And so we can be an important part of their circle of support, not just for all the medical stuff, but for the emotional piece too.
Absolutely.
Because it is super emotional when you're trying to get pregnant and things aren't as easy as you wanted them to be.
That's right. And we have that privilege of spending, an hour or more with individuals, and we can really be that support for them.
Yeah.
More than maybe their medical doctor can or their fertility specialist. So we can really create a bond and I
find I do that a lot during acupuncture too,
creating
because
bonds,
acupuncture is an important piece of traditional Chinese medicine that is super effective for fertility. We do a lot of pre-IUI or IVF acupuncture and post as well.
And there's great research for that as well.
Yeah.
That's coming to light. So
exactly. So some of my patients working on fertility, they're seeing me fairly often for acupuncture. And so along with the acupuncture, we're chatting, right? I get to check in with them and say, how's it going? Is it affecting your relationship? Because when conception is the goal, sometimes sex becomes a chore, right? So we talk about the stresses
strain
there
on the relationship at that point, and it's something that maybe both parties really want, and they want it so bad, right? So there's obviously strain there for sure.
Yeah. So there's a lot we can offer for people of all ages and stages who are looking at fertility, pregnancy, and then any other options as well.
And something that we talk about a lot on the fertility shift too is there's the preconception care all the way through hopefully if they can become pregnant, and then the last 3 months, right? So after birth, we call it the 4th trimester, which is also really important, just supporting individuals who have given birth, who are new parents. There's lots we can do for them as well.
Yeah, I love doing pre-labor acupuncture, which starts at week 34 gestation, ideally. And then we do weekly acupuncture preparing the body for the big day, for the big birthing day. Yeah. And then we can start induction acupuncture once the midwife or the primary care practitioner says, yes, it's go time. You can give birth anytime. And a lot of times, pregnant patients come in, they're like, okay, we got to give this baby an eviction notice, right? It's time to go.
Time to get out.
And we can do that. And that is such a fun part of my practice too, is to be like, okay, let's do this. So we get the acupuncture needles in. We'll sometimes add AcuStim as well to ramp up the power of the needles. Yeah. We have the parturient herbal tincture that helps ripen the cervix. And then, of course, there's lots of things that I can recommend for people that they can even do at home to start labor up. Yeah. And the conversations we have during those times are really important too. So I usually will bring up the concept of the golden month in traditional Chinese medicine. Have you guys talked about it on the fertility shift?
I'd like to know more about that.
It makes so much sense. So the idea is that for the first 30 to 40 days after you give birth, it's a time when you're resting. So if you're a human who's just like birthed another human, you should probably rest.
You need to rest.
Yes, exactly.
You can't do it all, right?
Yeah. So you see this in traditional Chinese culture is that at that point, other relatives will come and help with the cooking and the cleaning. And taken to the extreme in terms of traditions, the new mom is not even supposed to bathe. Now here in North America and, in modern Chinese culture as well, they're like, okay, I want a shower or a bath, right? Yeah. But the idea is that the support system is there and that the new parents just focusing on like breastfeeding, chest feeding, bonding with baby.
Yeah.
And in North America, we have this tendency to want to get back to it, right? Like
there's a lot of pressure for that.
So much pressure. Yes. Yeah. So I like to try to counteract the pressure to be like, not only am I giving you permission to rest and relax for the first few weeks after birthing, but I'm actually prescribing you the rest and relaxation of the golden month. So
I think that like gives individuals like that, okay, I can relax. I don't have that expectation of, okay, I need to get up. I need to take care of the baby. I need to clean the house. I need to, do all the things that Western society, puts pressure on us to do. I think giving yourself that time to really rest after giving birth and, spending that time with the baby and spending that time with your partner, I think those are all really important.
Yeah, absolutely. So there's a lot we can offer. You'll be offering these services in Sault Ste. Marie once you set up practice there. And we've been offering fertility support and preconception support here for years. And we love doing it because I'll tell you, there's nothing more exciting than like having a patient come in and say, hey, guess what? I'm pregnant. Or getting a photo emailed to you of a brand new baby. Yes. And, you kind of got to know that baby in utero a bit and did the induction acupuncture and then to get the birth announcement and
very
photo
rewarding.
It's awesome.
Yeah, that is awesome.
Yeah. You've been spending 8 years of your life studying like crazy so that you can be the expert that people go to. Like when their, cousin recommends they try, the keto diet or their friend says, hey, you have to take this supplement. It made a big difference to me. And they're confused because there's so much information. It's so overwhelming. Well, you wouldn't try to fix your own car if you're not a mechanic, right? You bring your car to a mechanic. Exactly. Yeah. So it's the same thing. I always tell people it's the same thing with natural health products, diets, trying to like optimize your health is go to see a naturopathic doctor because we're the ones who went to school for so many years and put so many hours in to become experts who can help you figure out what you really need. And we do that by developing an individualized treatment plan for each patient.
Yeah. Helping people just navigate that space. It's huge. And it really helps people because it's going from that confusion and I don't know what to do. And there's so much information to having someone who has that background to make the plan for you. Just simple, easy, and there to support. So
yeah, it's huge for people. So I understand you are from Sault Ste. Marie.
Yes.
And you plan to go back there to practice after graduation. So tell me a bit about what do you want to bring to the community in Sault Ste. Marie?
Yeah, so Sault Ste. Marie, love Sault Ste. Marie. Love the North, right? Northern girl at heart. Toronto has been great for me the last 4 years, but I think it's time to go back to my roots. Yeah. In the Sioux, I really just want to bring a lot of education the last 4 years, everything that I've learned. I really like women's health. I like fertility. I enjoy using all of the different modalities that I've learned. So I really want to reach as many people as I can. There are some NDs in the Sioux already, but there's, so many opportunities for us to educate the community and go out there and spread the word about what we do. So
absolutely. I think in Northern Ontario, there's so many people who haven't even seen a naturopathic doctor before.
Yes.
So I think it's awesome that you're going to a community that's got like a sizable population. And now with telemedicine, you can reach people who are in the surrounding area as well.
Yeah, across Ontario if we wanted to.
Absolutely.
Which is awesome. But yeah, those who might not have access to healthcare or who have barriers to reaching healthcare, those are all things I'm passionate about as well. So if we can reach someone who might not have had the opportunity to get the benefit of naturopathic medicine, that's a win.
Yeah.
Yeah.
Well, we were so thrilled to have you join us here at Thunder Bay Naturopathic Clinic for the month. And I'm just excited for Sault Ste. Marie that they're going to have you in their community next year.
Yeah, I'm so excited. I can't wait to graduate and hit the ground running.
Awesome. Thanks, Kelsey.
Thank you.